Hello, my name is Zoe and I work with the agent support team here at HealthSherpa. And today we're going to go over the dashboard as it stands now, as well as some of the exciting updates that we have coming for the 2019 open enrollment period. So I shared my screen and we are going to just walk through all of the different features. So just starting at the top, you have a tab here that says Insights. So this will be a high-level overview of how many leads you're processing, how many applications you've submitted, average plan premium, and total annual premium. So it'll just give you an overview here, and you can change the range of dates that you're looking at on the upper right. So you can look week by week, month by month. So that'll just give you a nice glimpse of what your business is looking like. Then we have the clients and the leads page. So the difference here, your leads page, these are folks that have begun the application process, but they have not yet completed it. So you might have been running a quote for them. They might still be shopping. It's going to have their status listed here and when the lead was last active. And you can resume at any time by clicking this resume button on the right. You can also archive a lead here if you happen to have a duplicate for some reason. So there's a few different ways that folks can end up in your leads tab. So one is by importing. You can import a spreadsheet. So just by providing their first and last name, their phone number or email address, you can import their data just by downloading this template, filling it out, and then finding it here and importing it with this button. They can also end up here by beginning the quote process. So the way that you would begin that process is by clicking this quote button in the upper right. So if you go here, you would just enter their basic information. So their zip code, you would add your basic info. They have a spouse or any dependents, you can add those here. And then you add the income. So I'm going to do 20,000. So on the right, it'll immediately tell you what subsidy you're eligible for and if you are eligible for a cost sharing reduction also. Now, if your income is below the threshold for subsidy, say 10,000, it will show you that if they're Medicaid eligible as well. And also for CHIP eligibility, that'll appear there. So let's go back to 20,000. And then if you scroll down on this page, it will show you all of the plan results for that area. And there's tools where you can sort these by lowest premium. If you go here on the upper right, you can sort by lowest premium, cost sharing reduction, deductible, max out of pocket. Or you can use these sliders on the left to put a maximum monthly premium if you'd like, and it'll sort the list. You can also add providers. If you wanted to search for a doctor, you would just enter their name and find a doctor and add them here and apply. Or you can add a prescription that you want to make sure is covered under the plan. Now, one thing that's important to note is there's a list of carriers here on the left that you can check and uncheck to sort the list. By default, we're going to select all of the carriers that you indicate you are appointed with. So when you're signing up for your HealthSherpa account, you're going to indicate which states you're licensed in and which carriers you're appointed with. Then when you're doing a search, those are automatically going to be selected first. So they will show up on this list. In order to show the other carriers, you'll have to filter them in manually here. So that's just our way of giving preference to those carriers that will actually pay you a commission. So now if you wanted to compare plans, you would just select the plans that you want to compare here. You can select up to 5. And then, excuse me, click the Compare Plan button on the right. So here you have a nice side-by-side summary of all of their premiums, deductibles, max out-of-pocket, their coinsurance, and you can even view the plan details, summary of benefits by clicking here. Now, if you click Enroll, that'll start you with the application process. And if you want to share this list with a client, say they need to talk it over with their spouse or they need more time to decide, you can click the Share button in the upper right and email it to the client. And they will receive this link where they can actually pick up exactly on this page, and they could even complete the enrollment themselves. So it's designed to be very collaborative. Your client can pick up where you left off, or your client, if they begin an application, you can see exactly where they're at in that process. And I'll show you how a client can begin an application in just a moment. And if you wanted to save them at this stage, you could just go to this, this button in the upper right, Save Lead, enter in their basic information, and then that's going to save on your Leads tab. All right, so we'll go back to the dashboard here. So we'll go back to the clients list. So this is where folks end up if they have completed their application. So they will automatically move from your leads list to your clients list. You can also import a list of clients here by clicking the import button. It will give you a template that you can download. And then this is the list of required fields. So you don't have to fill out absolutely everything on the template, you can, but these are the fields that you need to provide. And then you would just find the file and import it as a CSV. So then they'll appear here on your leads list. It provides a bit more information. You can click into each lead to view their details and their past application history, as well as their health coverage here. You can also add notes if you want to keep track of different meetings with your client there. So one important change that is coming soon, you will actually be able to upload documents on this page as well as view their payment status. So back here on this dashboard, instead of manually selecting your documents and payments, those are going to be updated in real time from the information healthcare.gov provides. So that's a big update, and we'll go into what that's going to look like in a moment. And then of course you can sort your clients. If you need to search for a specific person, you can search here. And then what you can also do is you can send out a renewal email to as many clients as you'd like. So you can select as many clients as you'd like here, click renewal email, and then it will actually send them a link where they can begin their renewal themselves online. And our renewal experience this year, it's going to be pre-filled. So they'll be able to search the application for their last year's application, and all of that information will populate into their 2019 application. All right, so then you would just click send now and it would send to the client. Or you can do the renewal yourself by clicking here, and that will begin the renewal process. All right, so next I'll show you the marketing page. So this is the other way that clients can end up on your leads list. We provide a custom enrollment website for you where your clients can self-enroll. So this is a great tool. You can put this on your website. Some folks put it on their Facebook page, share it in emails, and I'll show you what that looks like here. So this is the landing page. So they can begin the application here just by entering their basic information. And if they do, then that will automatically save in your leads list. Now they have a slightly different process for getting a quote. It's a bit more step-by-step, and we provide tips along the way. So they explain even who a dependent is, what a premium is, all of the basic information is there to help them out. And there's even a tool, we noticed a lot of people were having issues calculating their income. So here we even added an income calculator. So they can click in, they can look at their income based on the week, by the month, by the year, and add as many sources as they'd like by clicking the add button. And then it will automatically add, if you click back to eligibility, it'll add that in their household income. So then they would go through and see their eligibility here, and they would land on a similar quoting page. It will have a list of the different plans that are available, and they can compare side by side as well. Now, all of this progress will be saved in your leads page. So if they come back to you and they have questions or they need help finalizing their plan selection, they can come back to you and you can resume exactly where they left off through that process. So lower on this page, this is where you can customize your information. So you can edit your phone number here if you need to. You can upload your own logo, change the font colors that appear on that page. And then the lifestyle photo is that large circular image that appeared on the right. So we provide some stock photos here, or you can upload your own image. And then this part, Google Analytics, this is something you can set up separately, and then it would provide a code for you that you would enter here. And Google Analytics is just a way for you to track your metrics, how many clicks your website is getting, things of that nature. So you can just enter that code, click update, and then keep track of all of your data. All right, and if you are setting up multiple agents under the same agency, you can also set up an agency admin who will have this tab on the left that says agency. So if you click here, it will have a list of all of the different agents that are under your agency and how many total applications you've submitted. You can export your entire book of business from this page, or you can click into each individual agent to view their book of business. It's really easy to add a new agent. You would just click this gray invite button on the right and enter their email address. Or you can provide them with this code. Say you're onboarding a really large number of agents and you don't want to individually send them emails. You can give this join code. Then when they're going through the sign up process, it will ask, one of the options will be, I am an agent joining an agency with the code, and they will enter the code there. So one other important thing I wanted to point out is our referral program. So if you don't hold appointments with some carriers in your area, you can turn this setting on, and then any application you process with one of those non-appointed carriers will process as a referral. So that means HealthSherpa will actually pay you $25 for that application, and we'll go on as the agent of record. So you could either go through the sign-up process with your client, or you can just send them to your marketing link. And if they happen to choose one of those non-appointed carriers, then we'll process that as a referral and we'll pay you. You'll keep track of those referrals on this page. There will be a list, and then it'll show you the total amount due. You will want to come back to this page after your first referral goes through so that you can fill out your W-9, the tax form. That's where you will indicate where to send your check and who to make it out to. We also have an FMO. So if you wanted to get an appointment through HealthSherpa, you can request them here by clicking the blue request button. You can view the commission schedule. So we do offer Molina in California, Florida, Michigan, New Mexico, Ohio, and Texas. And actually, we've also added Christus in Texas as well. So you can request that by contacting our FMO support team, and I'll give you their information. And then we also offer off-exchange products, so Cigna Medigap, Humana Medicare Advantage, and United Health One for short-term dental and vision. So if you did want to add Christus or have any questions about the FMO, you can contact FMO_support@healthsherpa.com or call 888-845-3483, and they will help you. All right, so I want to go through some of the new updates that are coming for this open enrollment season. So I'm going to switch over here to this deck. So just briefly, I'll show you what the evolution of the technology is going to look like. So currently the way that it works is you'll start the application on HealthSherpa, and then after you get the quote and look at the different plan options, to complete the application, you'll actually have to go to healthcare.gov. So it will redirect you to healthcare.gov, and then you'll be directed back to HealthSherpa at the end to finalize your plan selection and submit the application. So that's called the double redirect. Then after that, we had the direct enrollment proxy, which meant that some applications could be completed on HealthSherpa, but a lot of them still had to go through healthcare.gov. This year, we will have EDE, or Enhanced Direct Enrollment, which means about 95% of your applications will go directly through HealthSherpa, and you'll also have a lot more post-enrollment functionality, which I'll show you in just a minute. And this is because we have full API access to the Federal Data Hub. So basically the back end of healthcare.gov, we have a direct line of communication to. And so this is what we can do now with Enhanced Direct Enrollment here on the right. So not only can you do your quoting and plan selection and see the eligibility results, you can also do most of your enrollments on HealthSherpa, you can do document uploads, and you can process binder payments for most carriers. So you can actually effectuate those plans and have visibility into the status of those documents and those payments directly on our site. So we have gone to what's called phase 2 of EDE, and so that means 95% cases are covered. Cases that aren't covered include folks with rare tax circumstances. So if they are not filing taxes, they're married but not filing jointly, they have children that aren't on their tax return, or dependents over 25. also Native Americans and Alaskan Natives. Those are not going to be covered on HealthSherpa. You can redirect to healthcare.gov to do those applications, and then you can still do the post-enrollment steps like document management and binder payments on our site. And the reason we didn't go to 100% is just because we would have had to ask about 50 additional questions to every applicant, and we thought that might hurt conversion rates and make it a longer process for you. So in order to just keep the time down on each application, we decided to wait until we have a more streamlined process for those other 5% of cases. So the big changes to the dashboard, this is going to be your client to-do list. So when you click into that client, you're actually going to have this convenient to-do list of if they still need to make their premium, if they need to verify with any documents, and then the status is going to be right here on the right, as well as the deadlines. So you'll also have visibility into this on your dashboard. So next to each client's name, where we saw before, documents and payments, they will have an up-to-date status there. So this is what the document upload will look like. So you'll just select the document type and upload here. We will also show you the status in real time and when it was submitted. And your clients can also log into their own HealthSherpa account and upload their documents themselves. And I'll show you exactly what that looks like too. Now, renewals are going to be pre-filled this year, which is just wonderful. This is going to save you a lot of time. So essentially, you'll just search for their application based on Social Security number and date of birth, or you can look by their name and date of birth, and then you'll be able to see their past applications here. To begin that renewal process, you will need to go through an ID verification step. This is something that healthcare.gov is requiring of all applications across all platforms this year. And what that looks like is you either need to verify with some document information, so driver's license and social security number, or you can answer questions that are generated by Experian based on tax information. So which address did you live at, or which employer did you work for? So you just have to verify through one of those two methods, and you only have to do this once as the agent. And then HealthSherpa will retain that information. So that's one of the benefits of doing it through HealthSherpa. And it also gives you that pre-filled renewal experience. All right, so we will have the ability to bulk email clients here. On the upper right, you can see a roll-up of all of the different actions that your clients need to take. So you can email 24 clients that need to make a payment. You can click this email button to email them all at once, or document reminders, so that will make it a lot easier to follow up with clients. And then, as I mentioned, the consumer can log into their own dashboard and upload their documents and make their binder payments as well. So when they go through the application process, it's the same. 95% can still do this completely on HealthSherpa. It's a much cleaner and smoother process than going through healthcare.gov. We've done a lot of research on the kind of user experience and made it very easy and provided tips along the way. Renewals for the consumer will also be pre-filled, so they would begin their renewal either through that email that you send, and by doing that, they would go through the same ID proofing step and then be able to have a pre-filled renewal with the information they did on the last year's application. So when they log in, they will also have this nice to-do list of exactly what they need to do and the status. So if they still need to make their premium, they can actually just click in there to make their premium for most carriers. And then they can upload their documents here directly. So this is what the document upload will look like for the consumer. You can see on the bottom here, there will be a list of accepted documents, which should make it easy for them. And then the phone number that appears here on the right will be your phone number. So if they have questions, they can call you. So they would just select their document type and upload here. Then to make their payment, as long as the carrier has a payment integration with healthcare.gov, so as long as you would be able to make that payment through healthcare.gov, you'll be able to make it on HealthSherpa. So you just click payment here. And then they have their application history. So if they need to make any changes, they can also submit those here and view all of their details as well. So we have a provider search, so if they want to see who's covered under their plan, they would just enter their name or specialty or zip code, and they could find on this nice map what providers are available in their area. And we also have a prescription search, so they can enter their brand name or generic name, the duration, and see if that is covered under their plan. and they'll get the estimated cost here below. So the best part of all of this is we are providing all of these new technologies to you for free this year. So there will not be a charge to use the platform or to submit applications this year. And we're really excited about this. The way that we're able to do this is through that referral program we mentioned, as well as interest from carriers. And we're honestly a mission-driven startup, so we want to help as many people get affordable healthcare as possible. And one way we can do that is by having a positive impact on your businesses, and to make this easier for you to help your clients get affordable healthcare. So we hope that this new technology will help improve your conversion rates, get more of your plans effectuated, and provide the best service to your clients and to you as possible. And I also wanted to mention, we have a great support team, so you can always call our support team and or email us. We even have a chat feature, so there's plenty of ways to get in touch with our agent support team if you ever have questions. And just briefly, I'll go back to where you can find our information. So on your dashboard, on the upper right, there's this gear icon. You can just click support, and that has our phone number. We're adding resources to frequently asked questions, and then our email address. So please never hesitate to reach out. We're here to help, and we really wish you the best of luck this open enrollment season. Thank you for choosing HealthSherpa.